Okay, so good afternoon, everybody. My name is Mariette Abraham, CEO and founder of PINA, the Hub for Data and Insights in Personalized Nutrition.
Hello, my name is Magnela Pretel. I'm a founder of Gym and Wellness. I'm really happy to be here. And we have today Claudine. How are you, Claudine? Could you introduce yourself?
I'm very good. Thank you so much. Thanks for having me. I'm looking forward to our time together.
So we have a lot of questions to ask you. You're a very, very interesting scientist, nutrition scientist, and we want to dig into that a little bit deeper. And so what we would like to start off with, we're not going to ask you to, introduce yourself with your whole background here. We're going to dive right in and start with a question. So all your background will become clear to everybody anyway. Okay. So what I'll just say is that right now you are a UK registered dietitian. You're based in the UK. You are in the middle of, or at the end of completing your clinical doctorate. So we'll get to that. But before we get into that lot of detail, can you talk to us about, your history? Where did it all start? Where are you from? Where did your journey begin? Let's start at the very beginning.
That's fantastic. Thank you so much. I don't know if you can tell by the accent, but I started my life in South Africa, in Cape Town. But it was during the apartheid regime. And I mentioned that early because it did actually shape the person that I am today. Although in the beginning, it was really, really hard because the way that I interpreted that for me was that I wasn't good enough. I wasn't clever enough and I couldn't think like other people. And so for a long while, it limited me and what I was able to do and what I believed that I could do. And so the journey that I am on today is sort of like a marvelous thing, but it all started way back then. So I grew up in, as I said, in Cape Town and not very many role models. So when I was feeling all these things that, I'm not good enough, I'm not clever enough, I can't think like other people think, I didn't really have people to sort of guide me and to show me anything different. So that is how I lived my life for I think nearly 37 years, until I had an epiphany about sort of who I really am, or at least the beginnings of the true Claudine, the Claudine that I now see and the Claudine that I now understand. But as I said, the Claudine that I am now was very much sort of informed by growing up in that kind of circumstances. And I think for me, the thing that stands out quite a lot from those formative years for me is my thought life, what I thought and how I saw myself. I saw myself through a lens of a limited self-perception, as I referred to earlier on. And I felt like I was captive. My thoughts took me captive and it held me prisoner, so to speak. And what I couldn't do then as a consequence of that was actually see what was inside of me, what my natural talents and abilities were and areas of gifting, and the biggest thing I think for me that encounter sort of, during that time was the fact that I just didn't value me. So I didn't see my worth and I didn't see my value. And cumulatively, those three things really, really shaped the Claudine, I would say, post 2008. Because
before we go to 2008, let's start with the Claudine that you were. Is that what you're describing, how you were at maybe high school before you transitioned into university, or how?
Totally.
What was that time?
Yeah, so up until I think 2008, my school years and my high school and certainly university, I'm surprised that I managed to get through all of those sort of experiences, actually achieving well. I was able to exceed and excel, not to the full potential that I now see for myself, but I was able to do that. And so many people through that believe that she was okay because she was able to do those things. But the way that I saw me, I couldn't appreciate the things that the achievements that I had at school, at university. And so almost in a way held me back. And I think that was the biggest thing for me. That was the thing that sort of held me captive in a way, not being able to embrace Claudine with, you know, the full potential that I'm now sort of living out, so to speak. And I guess that will inform, and that has informed the new version of Claudine, or this version of Claudine, and that will, again, you know, as we talk more moving forward, that will definitely come through into how it shaped the leader within me. But I'll leave that for later. So yeah, so up until 2008, I achieved, but I didn't achieve to my full potential. And, you know, I was 37 by the time I had what I call my epiphany, where I, for the first time, almost was diagnosed with what was wrong with me. Because I don't know if you, for the two of you, if you grew up thinking, you know, what was wrong with me? What was wrong with me? I was just listening to a TV program, you know, yesterday, and this person was saying that she grew up asking the question of herself, what's wrong with me? What's wrong with me? And that was me. What's wrong with me? You know, and so I'm really grateful today for my 2008 epiphany. And actually it was an event that I was invited to by a friend that I met in the UK. So yeah, there's lots to say, but anyway, I'll say this. So I was
we love to hear exactly, because this is the point when, you know, you make a change, and this is an opportunity to inspire everybody of us, because this is, I feel identified with several things. Even I took some notes, because I do have things that also happen in my life. Right. And we can, you know.
So in 2008, I found myself in the UK, having moved to the UK with my husband in 2000. But in 2008, I was invited by a dear friend to a Women in Leadership conference. But so at that time, I did not see myself as a leader, and I was questioning why this friend of mine felt that I needed to go with her to this event, and it was in Birmingham, and I'd never been to Birmingham. But she invited me along, and I'm so grateful today, because whilst I was in this room with all these amazing women leaders and hearing them speak about their journeys, their achievements, I'm thinking, what am I doing here? I'm not meant to be here. I'm not that thing. And so I guess imposter syndrome really, really kicked in for me at that point. But I'm grateful today, because what they covered at that event was actually a celebration of the 7 deadly sins of women in leadership. And I suffered from the first deadly sin, which was a limiting self-perception. So remember, I mentioned about how I saw myself. And that was affirmed and confirmed. And I was sort of diagnosed in that instance with having lived for the 37 years up to that point with this limiting self-perception. How I saw myself was through this limited lens. And so I just didn't believe that I was that. And, you know, in the sense that, why did she bring me to this event with leaders, people that are, you know, at the forefront of their careers and entrepreneurs? And here's Claudine. But yeah, so I'm grateful today, because when I had that encounter with all these women leaders, and then started seeing myself through this new almost frame of starting to unpick the scales, because when that came to me, it was like the scales were removed from my eyes, in that I could start to see Claudine, you know, the true Claudine, not the Claudine based on the lies that she believed for the last 37 years. And at that point, I didn't see myself as this leader. But interestingly, after that encounter, the first thing that I wanted to do was actually do a master's. So in South Africa, I had an opportunity to do a master's, and I thought, can't do that. That's for clever people. I'm not clever, so I can't do a master's. But the first thing that I wanted to do after that encounter was to actually do my master's, and not just any master's, was a master's in leadership. And so that was almost like the start of this new version of Claudine, you know, where I started seeing myself through a completely different lens. And actually, as part of my master's, when the final assessment of my master's, I did like a mini viva and a presentation. And the preparation for that, I actually developed 3 frameworks. an empowerment framework, a leadership framework, and an academic framework. And I say that to say that I couldn't embrace the leader within me if I didn't go through this process of empowerment. Yeah. So for me now as a leader, I see myself as a leader, through the lens of personal leadership empowerment, because I believe empowerment comes before leadership. At least that was my journey. And that is the message that I want to sort of also share with people, that for you to embrace anything, for you to embrace leadership, role model, whatever it is that you need to embrace, as part of your journey, as part of what you do, I do believe that aspect of empowerment is really critical, because until I went through that empowerment journey, and I'll just briefly say what that is, if you will allow me to, there's 4 elements. So my framework essentially was 4 elements, and it was 4 critical points that I had to go through to become this empowered leader. And the first one was that I had to get to know who Claudine was. Not the Claudine through the limited lens, but the Claudine with those scales removed, of beginning to see what was really inside of her. And so the first thing that I had to do was sort of almost come face to face with what was wrong with me, who am I in answering that question, and almost coming face to face with the things that were holding me back, the things that were limiting me. So that was the first thing. The second thing was I had to learn to reframe my circumstances. So before, through this limited lens, I saw myself as not good enough, not capable, not able to think like others, etc. But now in this empowerment journey, I had to learn to reframe all of that and start seeing myself, as the true version of who I am, and start seeing the giftings and the abilities and the talents within me. But in that, I also had to learn to reflect, because it's in reflecting in your circumstances that you actually enhance your learning. And so it's almost this reflection, this reframing and reflection going hand in hand. And I had to do that, and I had to learn that. And that really helped propel me to how eventually I started seeing myself and believing that I can. Because for so many years, 37 years of my life, I believed that I couldn't. And so the third almost component of this framework is self-belief or self-efficacy. The belief that you have about what you are able to do. And that is important for you to develop your confidence and your motivation to take action and to step outside of your comfort zone, which is component 4. So it's all about potential being the thing that you've not yet done, and so by getting to know who I was, by being able to reframe my circumstances, by being able to reflect on my learning circumstances, being able to start, seeing myself, believing that I can rather than that I can't, that really helped me to step out of my comfort zone and to tap into the potential, the things that I've yet not done. And cumulatively, those 4 sort of elements or components formed what I call the personal empowerment framework. And that I believe is actually the first step to you embracing the leader within. And the doctorate that, Mariette, you were mentioning that I am so close to finishing my doctorate. I do believe today that if I didn't go through that process, if I didn't have my epiphany, if I didn't sort of embrace this or become empowered using those 4 steps and acknowledge and accept that I was a leader, I would not be able to do this doctorate, or anything else that has preceded, anything else that I've done. And so for me, I really want to encourage people that, you have to embrace the leader within. But for some people, with a journey similar to mine, it's that empowerment aspect that precedes the leadership that allows you to embrace this leader within you, and not a leader with a title. I've never had a leadership title. I've never been Claudine Matthews lead anything, but when I did encounter people, they always believed that I was a leader, and they would always comment on that, and the reason why that has happened, I believe, is because the leadership was preceded by this journey of empowerment, really embracing who you are, really learning to reframe, reflecting, developing that self-efficacy, that self-belief that you can, and then stepping outside of comfort zone. And today, Claudine is almost an outcome of that journey, you know, that started way back in South Africa, but that was kickstarted in 2008. And I'm so grateful, so grateful. I'll stop there.
No, I just wanted to, you know, dive into this concept of, you know, self-awareness and that, because I think many women don't know what their beliefs are. Many don't know that they are capable, you know, and that self-efficacy maybe is, you know, is not a set thing. It's something that you that is, you know, forever changing and forever growing. It's really situation dependent. And having, of course, sharing this kind of South African perspectives, I was wondering, you don't live in a vacuum. I mean, you live in a community, you live in a family, the church plays a big role. And to what extent does that then influence you to be able to step out of it? Because that's a huge step. It's not only as a woman, because nobody else has done it. Yeah. It's then you're a woman in science because nobody does science, you know, it's like nobody really goes into science. And then the other thing of then, okay, now you're further going abroad, which is enough. So there's so many steps and levels where I feel that, you know, being in the comfort zone is probably the easier way to do it rather than having to face, because that's a lot of work. I mean, that sounds like a lot of work. And I mean, some people wouldn't want to admit that, you know, okay, there's something wrong, or, you know, I know I need to do some work, but I'll just, you know, read a book, keep a diary, and I'm good to go. But there's so much more to that. So I was wondering if you can speak to the environmental, the social influence that, despite that, you will still manage to, you know, go above and beyond.
Yeah, and I think you mentioned a key point for me. For me, certainly my faith has played a huge part in this journey of transformation for me. And because as I mentioned earlier, I didn't really have role models, certainly within my family. And up until, I guess, the time 2008, I didn't really have the connections and the understanding that I have now. And I guess the turning point for me truly was the 2008, and coming to the UK, I think changing the environment, because sometimes the environment, and I've learned that now, that the best places for me to flourish, you know, there has to be key things in that environment for me to flourish. And I've discovered that. And I think for me, it was changing the environment, coming from South Africa, where I felt really entrapped, you know, my own thinking, you know, and there wasn't anybody there to challenge that for me. So, so that was a huge thing, you know, and fortunately, I mean, when I came to the UK, I was married already, and both my husband and I, so he's a physio, and we came over, and I think we were both almost going through similar things. Me, because of the person that I am, I'm a talker, and so that really almost served me to take that action and to step out. So coming to the UK, and then surrounding me with people that were, I'm going to use the word forward thinking, or people that already was in the field of, or in their sphere of influence, and doing things that I wasn't doing, you know. So for up until 2008, I was in my little bubble. I was literally in my little bubble. I didn't have a network. I was, like you said, you know, didn't see anything for me. I'm a dietitian, and that's what I do, and that's what I know. So coming to the UK, meeting my friend Grace, who's a career coach and a life coach, and a leadership, you know, a global leadership developer, basically, you know, connecting with people like that. And I think for me was having somebody see the potential within me and calling it out.
Yeah,
that is a key point. So mentorship, and I think that's the point that I want to make, mentorship. So she sort of by default became my friend, became my coach, became a mentor. And what she did, which was pivotal, was call the leader without. Call that potential which she saw that I couldn't see because I couldn't see out of me, and said, Claudine, you're coming with me to this event. And I think that is so critical, that we need to surround ourselves with people that are ahead of us. Because sometimes also for us, when we're in our comfort zone, we want to have people that are the same or sometimes below us, so that we can be something within our littleness, if I can describe it in that way. But I think there is definitely something in surrounding yourself with people that are ahead of you, because you never know. That person might be what Grace, my friend, was to me. You know, that person that saw the potential when I couldn't see it for myself, and drew that out of me and put me in a situation that was completely out of my comfort zone. But that was the turning point for me to start becoming, embracing, growing into, developing the empowered person that I now am today. If that answers the question.
Yes, it's a really beautiful journey, and you've been very transparent. And I think this is gonna help us to see how your journey was formed. But I would like to know, why do you choose sickle cell research? Why you do what you do? Could you dig a little bit in that journey?
Great question. I think sickle cell actually found me. I had no idea. I almost never heard, I never heard of sickle cell until the point that I encountered sickle cell. And that came about because I was working in a East London trust, where the therapist manager, I was working as a dietitian in a therapist team, and the therapist manager, actually, she was walking past my office, saw me and said, "Oh, Claudine, would you like to represent the dietitians on a newly formed sickle cell MDT?" I'd never heard of sickle cell, but what came out of my mouth was, "Yes, I would love to." And that was in 2011. And it's 2023 today. So that sparked the journey. So in a way, sickle found me. I had never heard of it. I had to learn everything that I now know about sickle cell. And at that point, I never knew about nutrition in sickle cell. You know, then it was just the medical management of sickle cell. And there was an opportunity for me to accept a 12-month secondment working in a sickle cell service. And I thought, I need to do this. You see how the empowered, just seeing yourself in a different way, you're thinking, I have no idea, but what do I have to lose? So I accepted a 12-month secondment, stepping outside of my dietetic role into like a role that I knew not a lot about, working as a social liaison officer. But I said yes. I didn't know, but I said yes. And that's another important point for people to take note of. Sometimes you have to say yes and learn as you go along. And that was my journey, my introduction to sickle cell. So yes, accepted this 12-month secondment, which turned into four-year secondment. And it was 2014, so right at the end of my master's, that I actually read an article, and I am very transparent, because for me, it's all about how can you inspire other people to become the best version of themselves. So I'm going to continue to be very transparent. But anyway, so read this article about acute trauma as an emerging speciality in sickle cell disease. And as I was reading this article, I'm thinking, but that's what happens in the blood vessels of sickle cell patients. I haven't described what sickle cell is, but I'll get to that. But anyway, so when I was reading this article, I'm like, but if nutrition can help acute trauma patients, then why can't nutrition help sickle cell patients when there's like an overlap between the pathophysiology of acute trauma and the pathophysiology of sickle cell disease? And that started this whole journey for me in terms of, I need to know more. I need to know, is there a thing? Because up until that point, having been introduced to sickle in 2011, and this is 2014, I'd never heard of nutrition in sickle cell being a thing. So 2014, I did, looked at the literature to see if there was something, in that area. And there was over 60 years worth of research on the role of nutrition in sickle, but nothing had been done. No, the evidence hasn't been translated into information, evidence to support policy of practice, and so there was just nothing in that area. And then again, the empowered Claudine was like, okay, if there's evidence, if there's research, but nothing on the ground, then something needs to be done to change that narrative. And so hence why I thought in 2015, oh, I need to develop a national nutrition strategy for sickle cell. So this is how naive I was. You know, I was like, there's a problem, needs to be solved. But when I spoke to a GP that has a special interest in sickle cell, she said to me, Claudine, as a dietitian, for what you want to do, you do need to do a doctorate. You can't do it just as is, which is when I was right. I need to do a doctorate. Again, this is something I never ever saw for me, just like the masters for clever people. I've sort of done it afterwards, but never saw doctoral level training as, you know, for me. But I said, I've got to do that. I went to try to get some funding and support, and, you know, being sickle and nutrition, and it's something that isn't yet. There was not a lot of people interested at that point. So I went to the bank and said, I need money to do a doctorate. So I took out a loan and started this in 2016. And, you know, as a consequence of that, I was able to write articles that was published in our professional dietetic magazine, and also in CN magazine, another national nutrition magazine. And I was asked to write the first ever national nutrition standards in sickle cell that was published in 2018. You know, I hosted my first ever international nutrition in sickle conference as a consequence of that. Been invited to do lots of seminars on nutrition in sickle, and, you know, and so I'm now just under 4 months away from finishing a doctorate in nutrition in sickle cell disease. And so it found me. Very, very difficult journey, because no one was interested. I didn't know a great deal because it was something, there was a problem that needed to be solved. So quite pragmatic in the beginning, but obviously pragmatism isn't always the right approach if there isn't information or knowledge or understanding in that area. It's really shaped me, you know, it's shaped me in a way that, gosh, yeah, it really, you know, it was a hard journey. It was a hard journey learning what I know now, but I'm grateful at this part of the journey that I'm so close to being able to share the findings of the research and to become that thought disruptor in that space. Because still today in 2023, people still don't recognize the need for nutrition in sickle. And
I just want to jump in on that point, because I don't think really that you realize what a big deal it actually is, because of course when we studied, sickle cells was something that was like half a paragraph in a textbook, and I remember that I knew what it was, but very high level. I could like answer a question in an exam probably. I'd never ever come across sickle cell in clinical practice, even though I worked in the NHS for 8 years. And so it is a very, very I would call it a niche area. It's a highly specialized area. It's a very ring-fenced area and the reason for that is because it does not appear in every single population in every corner of the globe. It is really, really, really structured or limited towards minority groups, I would say. Mm-hmm. And so I was wondering if you can elaborate on what is the significance of sickle cell? Why does it only happen? And therefore, why are you, or how you then have become such a trailblazer in an area that really affects, you know, our people, because it doesn't get the attention and it definitely does not get the funding in terms of research to be able to answer those questions. And it is incredibly a debilitating disease. It impacts quality of life. You know, mortality is a fact that we're not even talking about. And so for those people who don't know, who never come across it, and only know from, you know, about it in a textbook, you know, what is it? And, you know, why should we pay attention? Number two, but yeah, most of all, why does nutrition play such a huge role? And you are, even though it fell on your lap, there was a reason why it fell into your lap, because the world needed it. And so now you are the world leader in nutrition and sickle cell, by default. And that's exactly what's happened.
It's a fantastic question. There's lots of layers to that, but essentially what sickle cell is, and I'll just very briefly, it is a genetically inherited disorder, and I think that's important. So it's a genetically inherited disorder, and it affects the hemoglobin molecule of patients living, sickle cell patients. And the hemoglobin is the main oxygen carrying component of blood. So if so the hemoglobin level, they have low hemoglobin levels, which means that there's less oxygen to circulated around the body. So essentially, sickle patients will suffer from what they call these three main clinical features. One is the chronic hemolysis, which is the rapid breakdown of red blood cells, which is where your low circulating oxygen levels come from. But the consequence of that is that patients will have chronic anemia and fatigue. They will have this rapid turnover of red blood cells, meaning they need to make more red blood cells. And usually normal red blood cells will live for about have a half-life of 120 days. For sickle patients, it's down to between 16 and 21 days. So you can imagine the impact that has on the patients. There's this increased oxidative stress. So this imbalance between the free radicals or compounds that actually damage the cell membrane. And so that is a huge problem that leads to chronic inflammation. You've also got the vaso-occlusion, and that is basically just the blockage of small and large blood vessels with sickle-shaped red blood cells. So under hypoxic conditions, i.e. low oxygen levels within the cells itself, the normal red blood cell changes shape and takes on the sickle shape, and that can actually, through various other pathogenic sort of processes, can actually cause the blockage of your small and large blood vessels. And that experience, or that process, vaso-occlusion, is where the sickle crisis comes from. And again, that results in ischemia, infarction, and that area can essentially die. And if that process happens repeatedly, which it does for many sickle patients, you can have the tissues in that area and the organs eventually giving in of those patients. And then the third component is the immune system, the impaired immune function, because for many sickle patients, the spleen actually doesn't work really well. And for many of them, they actually have to have splenectomy, so removal of the spleen. So you can imagine they have this increased risk of infections. And again, thinking about infection risk, impacts on malnutrition risks, and also on chronic inflammation, which has this long-term effect. And so just those three main clinical features of sickle cell disease are actually the main contributing factors to the nutritional needs of sickle cell patients. And this, again, in the literature isn't emphasized. So people hear nutrition in sickle, but they don't actually know what's the causal link between nutrition and sickle. So when I do a talk, that's the first thing that I have to do, because again, sickle cell patients themselves don't actually know what is that link between their condition and nutrition. And it's so fundamental that we actually understand that link, because without understanding that, the nutritional implications of sickle just doesn't exist. And then the other thing I want to add to that is just how we understand nutrition in sickle specifically, and the way that the literature describes nutrition in sickle is through this lens of malnutrition, undernutrition specifically, and the nutrient, micronutrient, macronutrient deficiency. But if you think about sickle cell, the patients, and you mentioned, Mariette, that they predominantly from an ethnic minority background, Black and ethnic minority background, if you think about that, then you have to look at outside of food itself, which is sort of where nutrition in sickle is almost centered. And whilst you do that, you're actually oversimplifying the role or the implications, the nutritional implications in sickle cell, and you're reducing sort of the importance of nutrition and the role of nutrition in sickle cell. So through my research, that is what I'm trying to highlight as well, is that when you're thinking about nutrition in sickle, it's so much more than food. Yes, food is important, but it's so much more than food. It's actually putting the sickle cell patient in the center of the conversations and the narrative to who are they, biopsychosocial, financial, all of those aspects, which ties in really well with your area of interest. And, you know, personalized nutrition, basically as a bigger conversation. But in sickle cell, for us to fully appreciate the full extent of the nutritional implications in sickle, we have to take this wider lens to understand the importance of the role of nutrition in sickle. And for that reason, we really need to start paying attention to nutrition in sickle, because as I said, as I started this question, to answer this question, there's a direct link between the pathophysiology, those clinical features I mentioned, and nutritional implications. And that is why nutrition in sickle is important and should be part and parcel of the standard care medical management of every sickle cell patient, not only in the UK, but around the world.
Great. Well, that definitely clarifies it, because obviously that connection is not known. So it's not only highlighting the role of nutrition within sickle cell, but it's also then changing and influencing practice so that it becomes ingrained, and of course, not only just into practice, but then further researched as well to see, you know, how can things be improved. And so that is really fascinating. So what I want to do is I love the journey of kind of your specialization in the nutrition, then kind of mapped, you know, you tagged on leadership, you know, in the meantime, but then the leadership is what drove you to then become the leader in sickle cell. So it's kind of like a, you know, like this journey that and that's why I always think people think of leadership as like, oh yeah, well, you do a leadership course and then you read a book and then you come to it. Doesn't work like that. It's like a never-ending journey, and then sometimes the journey takes you on a journey, because you didn't know it was going to go there, and all of a sudden you're thrust on the main stage, which you were meant to be there, but of course you didn't know that at the time. And so these journeys and your knowledge and your skills all come together. And so what I wanted to just dive into this leadership again, because of course what you then also did is write a book, and I see I've got a lot of sun coming out, so I'll do that. And I didn't turn into an angel, but yeah, can you talk through your book and how that came about?
Yeah, so the book is titled Overcoming Disempowerment, and it's literally sort of an overview of my journey from, you know, my days in South Africa, living very limited and seeing myself through a limited lens, to the person that I am today. And I think that's why I spoke, you know, so emphatically in the beginning about empowerment and leadership in that context. And for me, the book is basically a celebration of my journey, but as a way of inspiring others to embrace their journey. Because there's nothing special about me. You know where I started. I started believing that I couldn't, you know, for 37 years, not for 5 years, not for 20 years, but for 37 years. And I don't want other people to start their personal leadership journey when they are 37. I definitely want, you know, people to start embracing their journey as soon as possible. And sort of through the book, and it's sort of 10 steps to overcoming your disempowerment, to live purposeful and empowered. But it's basically using my journey, because, you know, I can only speak from my experience. Obviously, many people have had different experiences, different expressions of disempowerment. For me, my disempowerment was very closely linked to my growing up in South Africa under the apartheid regime. And so that's where the narrative comes from. But as I said, for someone else, it may be that you've had a diagnosis of something that has disempowered you, or you've, you know, pandemic, we've seen lots of people losing their jobs, livelihoods, etc., etc. So there's lots of things that can sort of disempower us. But my story is based on my journey from, you know, growing up in South Africa to where I am right now. And I start the journey with leadership So the first chapter is my story, but the second chapter is all about embracing the personal, the leader within. Because I do believe if we don't embrace the leader within, then the rest of our journey will be limited, will be sort of smaller than the potential that is within us. Because I believe we all have potential for greatness. You know, sometimes it takes us a little longer, like in my case, initially, it took me a lot longer to start seeing the potential within me, but we all have that potential. But I do believe personal leadership empowerment, which is what I mentioned earlier on, if we can embrace that part of who we are, then it sets us up for the battle. So in the book, I basically describe the steps through this metaphorical journey of us being in a battle, you know, and again, that battle can be whatever it is for you. But for me, it was overcoming the disempowerment of apartheid and how I saw myself. And so it starts with this leadership journey, and then it takes us on to how do we prepare for this battle? What do we need to do? What are the steps that we need to take to prepare for the battle? Because some of us choose to go to our comfort zone and to stay in our cave of comfort and say, I'm okay, I'm happy with this. When inside, actually, the narrative is a completely different narrative. And so in the book, I'm saying to you to be prepared for the battle. Yeah, to almost face this battle head on. What am I facing? You know, don't hide away, because you never know the beautiful journeys and outcomes that are hidden, you know, behind the battles and the disempowerments that we have. So embrace it. Be prepared for that battle. You know, don't run away. Do all that you can in terms of, you know, just preparing you for that mentally, emotionally. And I speak about body, mind, and spirit. I love taking a holistic approach, because I just think if I'm going to get a chance, I need to grab it, you know, with everything that I can. And so in the book, I speak about body, mind, and spirit, you know, in the whole of us. You know, what do we need to develop our spiritual side of things? What do we need to develop our physical sort of bodies? What do we need in terms of the mental side of things? Because we know that the battle is in the mind. You know, my journey for 37 years was how I saw myself in my head. I didn't see myself in the way that I should have. And so it's so important that we have to, you know, not only face this battle, but sort of take an holistic approach to how we do that, and then engage. You know, when you go to a battlefield, you're not just there for, oh, I'm here. No, you have to engage. You have to fight that battle with all of your might. You know, you have to push through, because sometimes there's so many hurdles for people, and they succumb. They're so close, but they succumb because they don't fight. And so in the book, I'm encouraging people push through, you know, because you never know what is waiting beyond that battle. And then the last part, so there's 3 parts. So I describe like the overcoming, I should have said this, I described the overcoming model, which is 3 steps. So you're seeking, so who am I? You know, embracing the leadership within you, and then you're transforming, which means you have to fight this battle, you know. So you're transforming, and once you come through this transformation of preparing, but also embracing and fighting through and pushing through, you aspire. And then you can embrace all of the beauty of what has come out of you because you fought this fight, you know. And again, even at that phase, for some people, it's like, can be too much, can be overwhelming. But I would encourage you to sort of like push through and keep going, because you never know. And what I've had to learn through this journey as well is that it's not just about me, you know, it's about the other person that I need to inspire and encourage with my story. So hence why I always write the framework that I developed way back in 2014, all of those, I wrote articles about them, because I thought if it worked for me and if it helped me, then I want to use that to help someone else, you know. And so you never know that your own journey and being able to, it's not, you know, not everybody's going to write an article. I wish everybody would write an article, because it's so beautiful. I never knew I could write, you know, so it was a really beautiful learning journey. And so I really want to encourage people with their story, you know, tell your story. We all have a story, like we're doing now, telling my story. But tell your story, because you never know who needs to hear your story and who will connect with your story. And that might be the epiphany that person needs for them to take action, you know, to start embracing the leader within, the power within, and to really step out of your comfort zone to embrace all of the potential that is within you. So this book is sort of a book of encouragement, you know, for people to embrace who you are. Start with your story, you know, start with your story. You have to start there, because my story today was influenced by my story way back. Your story today is influenced by your story, you know, way back. Because sometimes we don't want to face, and it was me, I didn't want to embrace the whole thing of racism and apartheid and all of that. For many years, I didn't speak about it. My brother, interesting quick story, when my brother read my book, he said, Claudine, I had no idea that you went through that. Yes. It was in my book in 2019, when he read my book, that he had the first glimpse of how apartheid affected me. And so it's important, you know, that you embrace that. I had to do that. And I'm grateful today that I could write the book where I could take myself there and say, that was part of my journey. You know, it's not all of my story, but it was part of my journey and part of my story, an important part that has influenced me on levels that is still surprising me day by day, you know. So that book is a celebration of your story, but embracing the leader within, in seeking who you are, transforming, pushing through, preparing for the battle, pushing through, fighting, and then aspiring to this life that, you know, it is out there, but you need to go for it. You need to believe that you can start again, because for many of us, you know, we've tried things and it hasn't worked. And then we decide it's not for us, because I've tried it and it hasn't worked. And I want to encourage you today that actually, you know what, you can start again. None of your experiences is ever lost. And like I said in my model, the empowerment model, the reframing and the reflection, you know, if we can embrace, if we can incorporate the reflection in our negative experiences, the learning, oh my goodness, the learning that we can get from those experiences is phenomenal. And so I want to encourage you, you can start again. You can reframe where you are. You can use that experiences to propel you to step into this new sort of potential and this new experience that you've not yet done. Yeah, potential is something that you've not yet done. That's a very basic definition of potential. It's something that you've not yet done. And you will never know if you don't take that first step. Yeah, and so the book is almost, for some people, will be that first step. Pick it up, read it. But again, knowledge without action leads to nothing. Yeah. And so I want to encourage you that if you're going to be changing the world in your sphere of influence, you need to take action, which is sort of what I had to do. And I'm grateful today for that.
I'm really, really eager to read your book. I'm really curious. And you're talking about leadership and reframing. So in science, we need a lot of reframing because of the colonialism, the racism, the you know, gender things that they didn't. So in your journey, for example, I did with genetic databases, and I'm going to talk very generally, so I don't, you know, like I don't get pinpoint people or anything. So for example, there is a lot of papers who they close this variation and say, like, the frequency is in our population is, you know, it's very predominant and things like that in this part of Europe and things like that. And then I went to the databases because I was, you know, like, how I'm young, I shouldn't question what other experienced scientists are saying about the genome databases and things like that. And then when I did my own research with more databases, I found out that the frequencies were not only in that part of the world. Like, there is African people with the same variant and a little bit of difference with the number, like 0.4% in European population, 0.4%, and then in South Africa, 7.3%, and then Latin America, 7.2%. So it was not specifically like that, because nature is not looking for divide us, actually. It's looking for survival, and everybody survive as a human. So, and then I you know, present like a portrait with worldwide, and people were like, no, still like, we need to detach from, you know, those narratives, and you're in an opportunity to reframe those as a leader, as an expert, and especially in the sickle cell. So tell us about what things you find it in those narratives that, you know, sometimes you have to re-question, like maybe it's not the way they saw it, and now you can have other eyes and saw it in another, you know, with more, but eyes from your life experience.
Yeah, I mean, I think to answer that question, and I think I alluded to the approach that I took with my research project I had to, like you, challenge what was out there, because initially when I started looking at the literature, I was like, oh, you know, there is a link, you know, and you know, between nutrition and sickle cell, because there's this research. And initially I was very naive, and I believed what they said, you know. I believe that it's in the realm of malnutrition, undernutrition, and micronutrient deficiencies and all of that kind of thing. And until I stopped and almost became true to me and did that reframing thing, I had to sort of take my brain to a place that I didn't want to go, and go with the racism aspect, the marginalization of sickle cell specifically, that, and bring that in to change the lens that I chose to in how I understood nutrition in sickle. Because initially I was swayed by that lens that it is, you know, just undernutrition, and, you know, and people kept asking me, but, you know, are you sure there's a link? Are you sure there's a link? And so I really had to go back and be brave and say, like, I need to look differently. I need to look at this in a different way, in a different lens. And that's my journey growing up in the apartheid regime, and certainly choosing to work with a sickle patient. There's a very, very strong link between that, because I experienced marginalization through my experiences, and the sickle cell patients are marginalized both medically and certainly in nutrition, because nutrition isn't sort of recognized as a thing. Mm-hmm. And I think that's where that correlation sort of came for me. But it took me a long while to get there, because I didn't want to go down the route of racism. I didn't want to sort of embrace that. But today, 4 months, you know, before I submit my thesis, that forms a really significant part of sort of the narrative and the argument that I make for nutrition in sickle. Because what I've discovered now is that when the marginalization of sickle cell leads to the invisibility of the medical management of sickle cell, which leads to the invisibility of nutrition in sickle cell. And it was important, and it is important, that that narrative and that framing of the problem of the lack of nutrition in sickle cell is communicated. Because, you know, it could have been that I'd done the research and I've just focused on malnutrition, undernutrition, or micronutrient deficiencies, and then have almost done a disservice to the patient, which is where the personalization comes in, where you have to put the patient at the central part of the research. And it was in doing that I was able to take, as I said, this comprehensive lens to explore and to investigate, how does nutrition in sickle, what is that narrative, how does it play out for these patients? And then based on that information, how do we find solutions to address that in a way that maintains the integrity in the central place of the sickle cell patient? Yeah, I hope that answers the question.
Layers of solution, right? It's not just only nutrition. You need to see more globally in trigger or fixing different angles. Otherwise, it's not going to be a solution.
Totally.
It's complex. Yes, definitely.
So what is next, Claudine? What is next in terms of leadership and sickle cell, and what does the future hold?
Well, it's an interesting journey. I will go back to what you said in the beginning, that it's not just a straightforward thing. There's so many levels of things that impact on where we are and our understanding and our leadership. And sometimes something has to end. So with the submission of the thesis and the doctoral journey ending, you sort of start a new beginning. But in that starting a new beginning, you then have to learn things. So I think the next phase is definitely sort of, how do I build on this research and how do I disseminate this research so that, you know, it benefits A, the patient, the sickle cell patients, and B, the ultimate outcome of my research, which is the aim of my research project, is actually to see nutrition integrated into standard care for sickle cell patients. So the next steps is going to be potentially me starting a foundation where this work, the findings of my research project, becomes the focal point of this foundation in terms of raising awareness of nutrition, the role of nutrition, but with the view of, and this is my vision for nutrition in sickle, that every patient living with sickle cell disease in the UK globally will have access to nutrition as part of their standard care provision. And the foundation will be based on that vision, that in years to come, the legacy of this research project and what I do and what I've been called to do is that every single patient with sickle cell will have access to nutrition service provision as part of the standard care. So when they go and see their consultant for their review of their treatment modalities, that a conversation is possible about their nutrition. Yeah. And that's not difficult, is it? No. Anyway, that just came, but I had to put that in there. And lots of books, and obviously translating the thesis into adding to the literature, because again, like you said, you know, there's so very little literature with this framing or an understanding of nutrition in sickle in the science world. And so I'm hoping that I will be able to sort of convert or translate the thesis into sort of books and obviously articles, etc., papers that will add to the literature, because this is the beginning of it. You know, there's so much more that needs to happen, and on the empowerment side, I want to do a lot more with that, because I do believe that, like you said, it almost comes full circle, that it was my empowerment, my introduction to leadership and empowerment, that made this doctoral level research possible for me. And now I'm going back to that. So I'm hoping to be able to teach people and put on training courses and write more books on the topic, because I do think there's a role for the two in science, in STEM, you know, so that we can empower more women to do what I was able to do, knowing that I started not empowered. And if I can do it, then everybody else can do it. And so that's what I'm hoping to do moving forward, is to be able to combine these two, that they almost run in tandem, because the one is interdependent on the other. And I really want to be able to embrace both of those elements, because we need both in STEM. Great.
Well, I really am very, very thankful for you sharing your journey with us. And I thank you for your leadership and, you know, trailblazing for really women in science, and especially women in nutrition science. And I am sure we'll see a lot more of you. Of course, we have to, because your journey does not end here. There's a lot more work to do. There's a purpose for you in terms of having your journey so convoluted, but so important, and also so inspiring to hear what you've done with it, and also that it's come from so much learning, you know, that you've had to overcome. And I think many times it's a hurdle that you can see, like maybe apartheid, you know, is there, it's there. You could see it because we were physically removed from, you know, where we were living and where we were going to school and like everything else. But then you have these personal hurdles that actually nobody can see, not even your own brother knew, that you then also have to overcome. So it's such a huge learning and such a huge growth curve that, you know, it's really amazing what you've achieved and how far you've come. irrespective of if it was at the ripe age, old age of 37. But nevertheless, you got there. And that is what really matters. It's like, it doesn't matter, because if you have a learning, a growth mindset, then anything is possible at any age and any time. And that's really where we want to really inspire, other women. So I thank you for your service, and I thank you for, coming on. And we'll also link to your book in the description as well, so people can learn more about you. And of course, I'm sure we'll hear a lot more about you, lots more to come.
Thank you so much.
Thank you very much.
Thank
you very
you.
much.